As the world mark International Nurses Day, today here nurses are being celebrated here at Phola Clinic here in Masoyi, just outside White River. It's one of the biggest clinics here in Masoyi actually, because they have seen a number of people coming in. Even today we've seen a number of people actually queuing in just to get into the clinic, because this is one of the biggest clinic here in this region, but also one of the clinics that actually people come to this clinic to actually receive some health care and also to see nurses that they always see around this community. But the nurses here are also very excited because they are celebrating this day. This is their day to be celebrated by the world, to be celebrated by their patients, and to be celebrated by the government. Let's speak to one of the nurses here, Francisca Ndlovu, Sister Francisca Ndlovu. May you've been a nurse for 35 years now. Just talk to me about it. How does this day mean to you as a nurse that has been here for more than 35 years?
This is a great day for me because as a nurse I really feel that I've done my job, and I believe what I came here for, that I have to see every patient, in every patient I see Christ. So that is why I'm here today, and this day means a lot to me because I can see that I've done a lot in these 35 years of age in the service.
You've been a nurse for 35 years, you've seen so many patients. This clinic is one of the biggest clinics here and it's so busy. Talk to me about like the numbers that you guys receive on a daily basis.
On a daily basis, we see plus or minus 500 patients per day, and we also see deliveries plus or minus 4 per day. We deliver 4 or less than 4 per day, and on monthly basis we deliver 55 patients. That is why it is a very big clinic and a very busy clinic, because all the feeder clinics, the 7 feeder clinics, refer their patients here. And this is a very big community whereby we are faced with a lot of challenges, whereby it is surrounded by taverns. So during the night it's very hectic, as well as during the weekend and holidays.
You're talking about like a lot of people coming in here now. Is we've got COVID-19. We see a lot of people coming into hospitals. You guys are in the forefront. How are you guys doing, and how do you guys feel about being nurses and being these soldiers that are in the forefront of this virus?
We are really committed. The staff is really committed. They are really doing their work as if there's nothing happening, but like every day's duty, they're doing very well. They're screening their patients, they are giving education, and they're treating the patients and managing waiting time for patients.
Talk to me about, we see now patients are standing outside, there's social distancing, we see them, you guys are trying to maintain social distancing. We also see there's numbers of queues, and you say that you guys receive a lot of people. What are you guys doing with these queues? Because there are a lot of queues that we have seen in this clinic.
We manage the queues. We triage our patients. We screen our patients. For those who we suspect who have got cough or the elderly, we prioritize them. We just push them inside so that they can be assisted very quickly, and we make sure that as we can see that the queues are outside, then we try by all means that patients do not get exhausted. They are being attended to very fast, and then they go home as soon as possible.
What are the challenges that you guys are facing as the nurses in the country and also here in Masoyi? What are the main challenges that you guys are faced with mostly?
The challenges that we are facing is that we are being short-staffed, but we are still doing our work, irrespective of being short-staffed, irrespective of the scarce resources that we have, but we are still maintaining our status. As I've said that Phola Nsikazi is an ideal clinic, so we are really working as a team so that things can go well.
Thank you so much. That was Sister Francisca Ndlovu. She's been a nurse here for almost 35 years, and she's talking to us about the things that they are doing actually to make sure that they protect themselves as nurses and also to protect the patients that are coming to this clinic. We are seeing a lot of patients coming in, and also they're standing in a queue, but they're also trying to maintain social distancing, and this is what we have been seeing, especially when people coming into the hospital, they're coming to this clinic rather, because they're trying to make sure that the people that are going to the clinic, there are actually a limited number that can go inside the clinic, because the clinic is not that big, but also to make sure that the people that are going to the clinic also, they don't congest the clinic. It doesn't become so packed, because already this is one of the biggest clinic and they are seeing a lot of patients on a daily basis. But also their jobs have become very, very difficult since the COVID-19, because now they have to make sure that they protect themselves, they protect their patients, and also to make sure that everyone is being supplied with a mask, especially their nurses, their protective gear. We understand that the province has also been struggling with with a shortage of staff and also with shortage of limited resources, but they are trying their best. They are saying that this clinic rather has like a lot of protective gear for their workers, and also they are very excited to celebrate this day as the rest of the world is actually looking at them to fight this virus. Back to you.